NCLEX 2026, the ultimate prep guide for future RNs. Hey, future nurses, welcome back. Today, we're breaking down the 2026 NCLEX RN Test Plan, what's new, what's unchanged, and how to prepare strategically so you pass on your first attempt. This is your complete 20-minute roadmap built from the official test plan and real clinical judgment patterns you'll see on exam day. What actually changed in 2026? Let's start with the biggest question. Is the 2026 NCLEX different? The answer, not in any major way. The structure, scoring, and NGN item types remain the same. Key updates you should know: safety and infection control is now safety and infection prevention and control, emphasizing proactive prevention. Substance abuse updated to substance misuse, modern person-first language. Stronger emphasis on equitable, unbiased nursing care. Expect more ethics-based judgment items. Passing standard unchanged, NGN format unchanged. These updates don't change what you study, they change how you think. How the NCLEX works in 2026. The NCLEX is still a computerized adaptive test. That means every question adjusts to your performance. The exam is designed to find the level where you consistently make safe decisions. You'll see case studies, bow tie items, trend items, matrix multiple response, highlight or drag and drop, traditional multiple choice. The exam isn't testing memory, it's testing clinical judgment. Now let's see the client needs categories. The categories are organized into 4 major client needs areas, with some further divided into subcategories. 1. Safe and effective care environment. Management of care, RN, coordinated care, PN, focuses on nursing care coordination, delegation, legal and ethical practice, and client advocacy. Safety and infection prevention and control, renamed from safety and infection control to emphasize a proactive approach to preventing hazards and infections. 2. Health promotion and maintenance, 6 to 12% RN, 6 to 12% PN, covers providing care related to growth and development, prevention and early detection of health problems, and supporting healthy lifestyles across the lifespan. 3. Psychosocial integrity, 6 to 12% RN, 9 to 15% PN, assesses the nurse's ability to support the emotional, mental, and social well-being of clients. Key topics include therapeutic communication, coping mechanisms, and substance misuse, renamed from substance abuse. 4. Physiological integrity. Basic care and comfort, 6 to 12% RN, 7 to 13% PN, includes activities of daily living, ADLs, nutrition, and non-pharmacological comfort measures. Pharmacological and parenteral therapies, 13 to 19% RN, 10 to 16% PN, focuses on safe medication administration, dosage calculations, and monitoring for adverse effects. Reduction of risk potential, 9 to 15% RN, 9 to 15% PN, evaluates the ability to reduce complications through diagnostic tests and monitoring for changes in patient status. Physiological adaptation, 11 to 17% RN, 7 to 13% PN, involves managing acute, chronic, or life-threatening physical health conditions. Key 2026 focus areas: health equity, explicit new requirement to apply principles of unbiased care and equal access during assessments. Advanced monitoring, increased emphasis on monitoring high-tech internal devices like intracranial pressure monitors, ICP. Digital privacy, modernized guidelines explicitly covering social media and digital information disclosure. Clinical judgment, the heart of NCLEX. The NCLEX uses the clinical judgment measurement model, which evaluates your ability to recognize cues, analyze cues, prioritize hypotheses, generate solutions, take action, evaluate outcomes. Let's walk through a rapid scenario. Mini scenario. A post-op patient reports sudden shortness of breath. Cues: tachycardia, low O2 sat,
Analysis, possible pulmonary embolism. Priority, ABCs to oxygenation. Action, elevate HOB, apply O2, call provider. Evaluate, reassess vitals. This is the thinking pattern the NCLEX rewards. NCLEX exam study strategy for success. 1. Study by category weight. Spend more time on management of care, Pharm, and physiological adaptation. 2. Practice NGN items daily. Case studies are the highest value practice. 3. Use active recall plus spaced repetition. Flashcards, rapid quizzes, teaching others. 4. Study with scenarios, not lists. The NCLEX tests judgment, not memorization. 5. Now let's discuss in detail about the NCLEX exam in 2026 with question types. The NCLEX is a computerized adaptive test, or CAT. Every question adjusts to your ability level. You may see between 85 and 150 questions. The exam ends when the computer is 95% confident that you are above the passing standard or below it. The NCLEX is not a memory test, it's a clinical judgment test. NGN item types were created to measure how you think, how you prioritize, and how you make decisions in real clinical situations. Every NGN question is designed to answer one big question. Can this candidate make safe decisions for real patients? First, let's discuss about the case studies items or questions. Case studies are the backbone of NGN. Each case study includes 6 questions, all tied to one patient scenario. You'll move through the clinical judgment measurement model. 1. Recognize cues. 2. Analyze cues. 3. Prioritize hypotheses. 4. Generate solutions. 5. Take action. 6. Evaluate outcomes. Example: a patient with heart failure is admitted with shortness of breath. Select relevant cues. Analyze which cues indicate worsening HF. Identify the most likely problem. Choose the best nursing interventions. Determine the priority action. Evaluate whether the intervention worked. And that's the full NGN clinical judgment pathway, 6 steps that turn chaos into clarity. If you can select the right cues, interpret them, find the real problem, choose safe interventions, prioritize using ABCs, and evaluate outcomes, you're already thinking like a nurse. Remember, NGN isn't about memorizing facts, it's about making safe decisions under pressure. Practice these steps every day, and the NCLEX becomes predictable. You've got this. Now let's keep building your clinical judgment. Next, let's discuss about bow tie items or questions. Bow tie items look like a bow tie. 3 sections: left, conditions or causes; center, actions; right, expected outcomes. Example: a patient with DKA. Left, select the most likely cause, infection or missed insulin dose. Center, select the priority actions, IV fluids, insulin infusion. Right, expected outcomes, decreased ketones, improved mental status. Bow ties test whether you can connect cause to action to outcome. This is real nursing. Next, let's discuss about trend items or questions. Trend items give you data over time, labs, vitals, assessments, and ask you to interpret the pattern. Example: a post-op patient's vitals over 4 hours. HR is 88 to 102 to 118 to 132. BP is 128 over 82 to 110 over 70 to 98 over 60 to 86 over 54. Urine output decreasing. This trend screams hypovolemic shock. Trend items test your ability to see the big picture, not isolated numbers. Next, let's discuss matrix multiple response items or questions. These look like a grid. You'll see symptoms, interventions, or assessments on one side and categories on the other. Example: for each assessment finding, indicate whether it is expected, concerning,
or requires immediate action. Matrix items test your ability to categorize information quickly and accurately. Next, let's discuss highlight text items or questions. You'll get a paragraph of information and must highlight the relevant cues. Example: a patient with pneumonia reports increased sputum, new confusion, mild headache, ate breakfast normally. You highlight increased sputum, new confusion. Highlight items test whether you can filter out noise and focus on what matters. Now let's discuss drag and drop items or questions. These items ask you to drag answers into categories or sequences. Example: place the steps of sterile wound care in the correct order, or drag each medication to the correct classification. Drag and drop tests your understanding of processes, sequences, and relationships. Let's discuss traditional multiple choice items or questions. Yes, the classic NCLEX question is still here, but even B's now reflect NGN thinking. Example: which action is the nurse's priority? This still tests clinical judgment, not recall. If you understand these item types, you understand how the NCLEX thinks. And if you understand how the NCLEX thinks, you can pass with confidence. Your 30-day NCLEX prep plan. I'm giving you a 30-day NCLEX prep plan that's realistic, strategic, and built around the 2026 test plan. How this plan works. This plan is built around 3 principles. 1. Clinical judgment first, because NGN is the heart of the exam. 2. High-yield categories, management of care, Pharm, and physiological adaptation. 3. Daily practice, because consistency beats cramming. Let's break down your next 30 days. Week 1, Foundations and Safety. Theme: build your base, strengthen safety. Goal: understand how the NCLEX thinks. What you study this week: safety and infection prevention, management of care, delegation and prioritization, basic Pharm safety, and clinical judgment model, CJMM. Daily routine: 20 to 30 NGN questions, 1 case study per day, review rationales deeply, and 20 minutes of content review. Why week 1 matters? If you don't understand safety, you can't prioritize. If you can't prioritize, you can't pass. Mini scenario. A patient with COPD has O2 sat 91%. Another patient has blood glucose 52 milligrams per deciliter. Who do you see first? Hypoglycemia kills faster. This is the thinking you build in week 1. Week 2, Systems and Scenarios. Theme: build clinical depth. Goal: strengthen med-surg reasoning. What you study this week: cardiac, respiratory, neuro, renal, endocrine, OB and PEDS basics, Pharm by system. Daily routine: 40 to 60 questions, 1 to 2 NGN case studies, 10 to 15 minutes of Pharm flashcards, 1 system review per day. Why week 2 matters? Most NCLEX questions come from med-surg and Pharm. This is where you build speed and pattern recognition. Mini scenario. A heart failure patient gains 2 kilograms in 24 hours. What's your priority? Assess for crackles and give diuretics. This is the clinical judgment the NCLEX expects. Week 3, High-yield practice. Theme: train like it's exam day. Goal: build stamina, accuracy, and confidence. What you study this week: prioritization, delegation, emergencies, shock, ABGs, fluid and electrolytes, high-risk Pharm. Daily routine: 75 to 100 questions, 2 NGN case studies, 1 hour of rationales, 1 mock exam midweek. Why week 3 matters? This is where your brain learns to think fast under pressure. You're building the mental endurance you need for a 3 to 5 hour exam. Mini scenario. A patient with sepsis has BP 86/50 and lactate 4.2. What's your first action? Give IV fluids before vasopressors. This is the kind of high-yield reasoning Week 3 sharpens. Week 4. Final prep and confidence building. Theme: polish, refine, strengthen. Goal: enter test day calm and prepared. What you do this week: 2 full-length mock exams, review only weak areas, light content review, sleep, hydration, and rest. Practice 1 to 2 case studies daily. Review lab values, isolation, and Pharm safety. What you stop doing: no new textbooks, no cramming, no 300-question marathons, no comparing yourself to others. Why Week 4 matters: your brain needs to consolidate, not overload. Mini scenario. You're reviewing labs. Which is most concerning? Potassium 2.8, risk for lethal arrhythmias. This is the kind of quick recognition you want locked in. Final test day strategy. On test day, eat something light, bring water, use the tutorial to calm your nerves, take breaks, read slowly, trust your training. Remember, the NCLEX is not trying to trick you. It's trying to confirm you can make safe decisions. If you follow it consistently, you'll walk into the NCLEX prepared, confident, and ready to pass. Let's walk through a full NGN case study scenario together. A classical condition of heart failure exacerbation. Your patient is a 68-year-old male admitted with worsening shortness of breath. Let's see the patient background. Diagnosis of the patient is chronic systolic heart failure. History: hypertension, CAD, MI 5 years ago. Medications: currently on furosemide, lisinopril, metoprolol, aspirin. Allergies: none. Socially, he lives alone, low sodium diet, inconsistent. Current assessment: RR 30 per minute, O2 sat 86% on room air, HR 118 per minute, BP 158/94 mmHg, temperature 98.4 degrees Fahrenheit, lung sounds: bilateral crackles worse at bases, edema, on assessment 3+ pitting in both legs, weight increased additionally 3.2 kilograms in 24 hours. Patient states that I can't lie flat, I slept sitting up. Now let's see the available labs. BNP 1,820 picograms per milliliter, which indicates increase, K+ 3.4, NA 132, creatinine 1.9, increased from baseline 1.2. So in this clinical scenario, the first question is, which cues indicate worsening heart failure? Select all that apply. And let's see what the correct analysis is. Correct analysis: these findings indicate worsening heart failure. Let's see one by one. Weight gain indicates fluid retention. Crackles indicates presence of pulmonary edema. Low O2 sat indicates impaired gas exchange. Tachycardia indicates compensation. Elevated BNP indicates worsening HF. Orthopnea indicates fluid redistribution. Your job is to connect the dots, not just list symptoms. The second question out of the same scenario: what is the priority action? Correct answer: apply oxygen and raise the head of the bed. ABCs always win. In this case, fix breathing before fixing fluid. Next, let's see the third question from the same scenario. Which findings indicate the intervention was effective? Correct outcomes: O2 sat improves to 94%, RR decreases, crackles lessen, urine output increases, weight decreases, patient reports easier breathing. Evaluation equals did the patient get better, worse, or stay the same? Finally, let's see the fourth question out of this scenario. What is the primary problem? Correct answer: the primary problem in this given scenario is fluid volume excess. Secondary problems are impaired gas exchange, decreased cardiac output. Always identify the root cause. Everything traces back to fluid overload. And that's a full NGN-style model question walkthrough. If you can think through these steps, you can think like a nurse. And that's exactly what the NCLEX is testing. Thank you so much for spending this time with me and investing in your future as a nurse. Preparing for the NCLEX in 2026 is a journey, and the fact that you're here learning, practicing, and sharpening your clinical judgment already puts you ahead of the curve. Remember, the NCLEX isn't just a test. It's a milestone that proves you can think like a nurse, act like a nurse, and care like a nurse. And you've been building those skills every single day. If this video helped you feel more confident, more prepared, or more focused, make sure to hit that like button and subscribe, because I've got even more NGN case studies, priority questions, and high-yield breakdowns coming your way. Drop your questions or topics in the comments. I read every single one, and your feedback shapes the next videos. You've got this. Stay consistent, trust your training, and walk into your NCLEX knowing you are ready. Thanks for watching, Future RN. I'll see you in the next video.